Hello and welcome to a new episode of Majlis podcast by Emirates Hospital Group. I'm Wael Berro and family medicine consultant at Emirates Specialty Hospital. Today we're talking about kidney stones, and who's better than that than my colleague Dr. Durrani.
Hi, I'm Dr. Abdul Munnon Durrani. I'm a specialist urologist in Emirates Hospital Jumeirah, and I'm a super specialist in urology.
Very nice to have you on board with us today.
Thanks.
We're going to talk about a very common topic. Many people suffer with this, but sometimes could be misunderstood. So let's keep it simple. Kidney stones, what are they, and how do they come from, and what should we do?
Okay, so basically kidney stones can be defined as stones, or these are minerals in the urine. So normally body excretes these minerals in the kidney. And when there is supersaturation, we can say that when there is dehydration or there is less urine in the kidney which is being filtered, these particles stick together and become crystals. And there's a layering effect. And when the products are like that, so they become stones. So these are basically what we call as kidney stones. And the most common one of them are calcium oxalate, calcium phosphate, uric acid, and some genetic reasons which cause cystine stones, for example.
Okay, good. That's a very nice summary. Okay. Now, like everything in medicine, we have the genetics. You mentioned the cystine ones that we can blame our family for it, but then there are things that we are at fault at it.
Yes.
Who is at risk of having kidney stones, and what are the things that I'm doing as a person that puts me more at risk? Let's put it this way.
So basically, the risk of stones vary and depends on multiple factors. One of them would be, let's say, climatic area where we stay over here, geographical areas, dietary factors, lifestyle factors, and of course, as you discussed, genetic factors. So common areas like we are in Dubai, so it's very hot over here. So we tend to drink less water, for example. So one of the reasons for kidney stone formation is taking less water. So nowadays people have a lot of health issues. For example, they are working in the sun, they are laborers, or they are going out walking in the sun, and it's very hot. So if they take less water, that's one of the reasons for having kidney stones. Most people also have a lifestyle. Those who are health conscious, they drink lots of sodas, for example, and fast foods. So currently in Dubai, as we know, we all are working over here. We don't get time much to cook our own food. So we order from outside. So having lots of sweetened beverages, these energy drinks or fast foods can also lead to stone formation. So this is the second factor which is responsible. And of course, if you're taking a high protein diet, for example, you're taking lots of red meat, you're taking fish, you're taking beef, you're taking salmon and everything. So these factors which are high protein contents in the food can also lead to stone formation. So basically we also recommend that you have to drink adequate water. So at least you should drink around 3 liters of water. So your urine is 2.5 liters. So that is the most important. Second, you should avoid sodas. If you're taking sweetened carbonated drinks, so for example, that has a lot of fructose. So it excretes a lot of calcium in the urine. So this is another reason for stone formation. So there was a study by National Kidney Foundation in 2024, which shows that if you drink 2 soda cans per day, 10% of the people have proteinuria, and in the long run, end-stage kidney disease. And almost 25% of those people had kidney stones. So that's the second factor. Third factor, we have certain things in the diet. For example, as you know, some stones are calcium oxalate stones, which are the most common. So we don't tell people to stop calcium. So actually calcium is beneficial in the diet. So you have to have 1 gram of calcium per day to avoid calcium oxalate stones, because calcium actually binds oxalate in the intestine. So dairy products 3 times a day is a good remedy to have good calcium. Then if you're having lots of oxalates, for example, oxalates are found in, we are fond of eating spinach, fresh spinach, lots of tomatoes, and peanuts and nuts. So that has a lot of oxalate content. So if you're fond of having this, you have to cut down on that. So other option is, for example, if you have lots of sodium. So as we know, sodium leads to hypertension and other problems. So sodium you have to cut down. As we know that we should take around 5 grams of sodium per day. So that is also important because sodium excretes calcium more in the urine. So all of these things are basically lifestyle products. And of course, if you're running too much, you're exercising, we all going to the gym most probably, but you have to have adequate water intake. That is the most important thing. Third, some people have low citrates in the urine. So basically citrates are found in citrus fruits. So if you have good adequate lemon juice and orange juice, so that is the most important thing, and you can add that to your diet. So these are the basic lifestyle factors. And about the risk also, some people have, for example, anatomical problems. They will have obstructive kidneys due to by birth defects or a reflux. They also have more chances of stone formation. Especially those people over here in Dubai, we have seen in our practice that most people do bariatric surgeries. So if someone has done bariatric surgery, he also has more chances of stone formation. So he has to check with the urologist that everything is okay. And lastly, some people who have chronic kidney disease or continuous UTIs, we have to check in them. So also certain diseases, as you're in internal medicine, we know that hyperparathyroidism can cause stone formation, or hyperuricemia, or taking excess supplements. Over here, I also noticed that most of the people take supplements. For example, they have, I ask patients, they take lots of vitamin C. So if they're taking more than 1 gram per day, that leads to high oxalate content in the body and stone formation. So we're not supposed to take more than 60 milligram per day. Also, if they're taking calcium supplements, some people do recommend calcium and vitamin D supplements, but you have to take that in moderation and with the doctor. You have to talk to the doctor if you want to take these supplements. So most of these are the risk factors for stone formation.
Thank you very much. Very nice way of summarizing it. And I like the fact that we have to focus on our lifestyle, because yes, we can blame our parents for many things, but at least for this, probably it's on us as well.
Yes.
Now, before I get you off your comfort zone, I just want to ask one question about the calcium, about the kidney stones. So for our audience, because we hear a lot, and I see a lot in my practice, people kind of coming with back pain saying like, oh, it must be a kidney stone, though they never had kidney stone. What are the common symptoms that patients should be aware of, and then when they need to seek medical help?
Yes. So as we discussed in the last discussion, kidney stones, majority of them are silent. Okay, so we don't know whether we are carrying kidney stones. So it's a good habit to go to the doctor, any doctor, to check up everything. But there are certain kidney stones which are big and which can migrate into the tube. The tube basically is called the ureter, which connects the kidney to the bladder. So any stone passing through that will give, first thing, pain. So if you have a back pain which is very severe, let's say out of a score of 0 to 10, you have 8 by 10 or 6 by 10. You're feeling nauseous, you're feeling that you're going to vomit, and suddenly you feel that you have the urge to pee, and then the pain is not responding to basic painkillers, because most of the people will take paracetamol or something, they are smart enough, and it's not responding, and you have pee which is showing blood. So all of these symptoms, and including, yes, maybe you can develop fever also. So all of these symptoms can in medical terminology, we tell that it's a ureteric colic. So immediately you have to come to the emergency and you have to see a doctor. So this is the commonest presentation. But there are certain people also which will have kidney stones. They are growing in the kidney and they're not causing any blockages, so they will not cause pain. So in high risk people, for example, someone who has a stone already in the past, he has a chance of, let's say, 50% in his life and almost 25% in the next 5 years. So these are the people who are high risk formers and they have to check. So basically a medical annual examination is good enough to check for kidney stones, especially in our area in Dubai, where a lot of heat is there. We don't drink enough water, we get dehydrated, we exercise, we sweat a lot. So we have to be careful.
Perfect. Thank you. Now, we're going to remove the hat of the doctor. I want to hear something personal. So tell me about something personal from your experience. Could be professional or something on a personal level as a doctor that you want to share with our audience.
Well, basically, we see lots of patients and they have good emotional stories, and we can share one of them. That there was one patient when I was young and he was a child. So basically, he had bilateral ureteric stones. So the patients were very poor and it was in my country. So basically, they were very emotional. So his creatinine was rising and we had to stent him in the emergency in the night. I remember the father, because he's the son, he was the sole, I was around 10 years old. The son and mom were so thankful to us, they organized a party for all the staff who put a stent at that time. So it was very, heartfelt. People appreciate that as doctors we are doing something. We're coming in the middle of the night, we are stenting the patient, we are saving a life, and they were very grateful. And this was the thing which touched me, that they actually gave a party to all the staff because we just stented the patient. So that's one of the things.
That's very nice. Thanks for sharing that. And also, it's always a constant reminder that people see us as doctors, and there's always that gap. But at the end of the day, we're people. And whenever we connect on a personal level, it's beautiful, irrespective of what we're sharing with each other.
Yes, that's true. That's true.
Thank you very much, Dr. Durrani. And let's move back to the topic of kidney stone.
Yes.
Now, from a patient perspective, we hear kind of the same thing. Like, I go to see the doctor, and then one will decide I need an X-ray. The other one will say, oh, no, I think an ultrasound. Or the other person will tell me you need a scan, which is called a CT scan. Where do radiology investigations fall when it comes to kidney stone? What do I need to do to prove whether that back pain is a muscle pain or a kidney stone?
So basically, whenever a patient comes to us with back pain, so there are different things in the back area which we can label as the source of the pain. So as you said, one of the things in our department is a kidney stone, a stone which is migrating in the pipe. Then the other differential diagnosis would be a skin pain, herpes, for example, a musculoskeletal pain, for example, spasm, or colon is there in that side, or there are other organs like the liver, the gallbladder, which can cause pain. But for us, as we have to diagnose stone, first we ask history properly. We understand from the history, which I said last time, that pain which is beyond controllable, nausea, vomiting, pee problems, blood in the pee. And then we have to diagnose. How do we diagnose? As you said, the first screening test we do is an ultrasound. So ultrasound is basically involving, as we all know, waves of sound waves, and which we check the imaging in the kidney area and the ureter. If we find a swelling, that confirms the stone. But we also have to understand there is a topic or a concept called sensitivity and specificity. That out of, let's say, 100 people, you do 100 ultrasounds, how many people will pick up a stone on that ultrasound? So sensitivity for ultrasound for kidney and ureter stone is only 45 to 50%. So there's lots of majority of people we can miss even on the ultrasound. So then we have to add the clinical picture, the urine picture, the blood picture, which includes, for example, a raised creatinine, which is in the blood, and then we decide for a CT scan. So for example, even we have a diagnosis with his pain and we can't see on the ultrasound, the 100% is a CT scan. So we offer CT scan without a contrast usually for the diagnosis in the emergency. But when we are supposed to plan, because we have to plan, let's say there's a stone which is moving in the pipe, then we have to remove it or give medical expulsive therapy. Then we do a CT with the contrast. X-rays are also good to pick up stones, plain X-rays, but there are some stones which are radiolucent. So basically you can't see them on the X-ray as well. So I think latest guidelines say that you have to have a diagnosis where ultrasound is not specific, you just do a non-contrast CT. So that is one of the important diagnostic imaging tests.
And the beauty now is that actually CT is more available in most centers, especially here in Dubai. We're very lucky that we can do CT easily.
Yes, that is true. Nowadays, in the old times, let's say 20 years back, we only had one X-ray, which is the old system, and one ultrasound. Then we had to send people to special centers for a CT. Nowadays, in every hospital, you have a basic CT. Nowadays, we have low-dose CT. So it's a very good concept where you don't give too much radiation also, and it picks up the stone. Even the current guidelines, in the last step for pregnant females also, they recommend if you can't find on ultrasound and MRI, you can do a low-dose CT for pregnant female. This is the latest European
That's very interesting. I'm sure many women will be afraid to do that, and many people. Okay, fair enough. Now, medicine is evolving, and I'm sure the same in urology. Technology is changing, and we have to stay up to date. And we always hear of non-invasive surgery, non-invasive procedures. Tell me about that in the field of urology and kidney stones.
So basically, the stone, as we say, would be in the urological tract. So what is the urological tract? It could be the kidney, that we call a kidney stone. It could be in the pipe which connects the kidney to the bladder called the ureteric stone. And then it could be in the bladder called a bladder stone. And of course, when it tries to come out, it's a urethral stone. So depending on the location of these stones, we have treatment options. In the olden times, we used to cut. As we said, the bigger the surgeon, the bigger the cut. So that was 30 years back. Nowadays, due to technology and miniaturization of all the instruments, now we have minimally invasive techniques for treating kidney stones. Let's say we have to treat a kidney or ureteric stone. The first thing I tell patients, we have a non-invasive method called shock wave therapy. So basically, a shock wave would be a sound wave, okay, and we have a balloon which is attached to the abdomen of the patient, and we focus the stone by ultrasound or X-ray and target the stone with shock waves. So this doesn't involve a cut or going inside the body. So from outside, just touching the body, we can break the stones. That is the number one thing we have. The second thing we have is a little bit of more minimally invasive thing, which we call as ureteroscopy. So nowadays we have cameras which are very small, less than 3 millimeter in diameter. And you can take the camera through your natural orifice, which is the urethra, into the ureter, into the kidney as well. This is called retrograde intrarenal surgery. There you can see the stone, take a laser, break the stone into small pieces, take them out. So this is the next advance we have in urology. Third, we also have certain instruments, for example, certain limitations where you can't do this thing because the stone is very big, let's say 4 centimeter. Then we have something called PCNL. That basically you make a small hole in the skin, and through that hole you take a camera, go inside the kidney and break it down and take it from there. And lastly, we have some unfortunate patients or some few cases where you can't do all of this. Then you land up with a laparoscopic or robotic surgery in that. But nowadays that trend has almost decreased. It's less than 1% we do that. So even if we have a big stone, you can stage it. For example, let's say someone has a 3 centimeter stone in the kidney. Either you can do PCNL or you can even do stage RARS. That means you go from inside, break the stone down with a good laser, wait for some time, call again after 1 month and do it again, and you clear all the stones. So technology has advanced, science has advanced.
And that's always to the benefit of the patient compared to where we were many years ago.
Yes.
Because you mentioned stenting.
Yes.
And before, when you were telling our personal story, but you didn't mention stenting now. Is that still common given the new technology that's happening?
Well, basically stent is just a tube. It was analogous to the heart stent. So example, you had a heart blockage, you stented that. So for the kidneys, there are certain indications where we put stents. For example, a stent would be put in a patient who has severe obstruction, and there's a bad case where the stone is stuck in the pipe and it has caused lots of edema, lots of swelling, lots of bleeding, you have infection. Then we put the stent before the procedure, or usually after the procedure. If things look bad, we put a stent. So basically stent is just a tube. It drains the kidney from the kidney area to the bladder area. So you don't have any swellings, you don't have any residual stones getting stuck, any clots getting stuck, and it's a safe pathway for the patient. So that's it.
Fair enough. Dr. Durrani, thank you very much. You summarized a complex topic, but very common topic, very simply. Thank you very much for your time. Any last minute or take home message you want to tell our audience today?
So the last message I would like to tell you is that, see, we have only 2 kidneys. So we have to protect it. So how do we protect it? For example, we should not have hypertension. So that's where the internal medicine comes in. One person should not develop diabetes. So he has to take care of his sugar levels, his cholesterol levels, his blood pressure levels. That will save the kidney. So that will be the medical part. Then as surgeons, we have to know that there should not be any anatomical problems. And most important is take care of your kidneys. Make sure that no one has stones. In this climate, I see majority of our practice is stones. And people also don't know they have stones. So come to us in Emirates Hospital, Jumeirah, have a consultation with us and screen for stones. Stones is the preventable thing which prevents end-stage kidney disease. So this is one thing we can remove and the kidneys are saved.
A simple test, a simple procedure to do that would definitely have major impact. And I have no doubt at Emirates Group overall we have amazing urologists. Thank you very much for your time.
Thank you.
This brings our episode today to an end. Thank you very much for listening, and stay tuned for another episode of Al Majlis podcast by Emirates Hospital Group. Thank you, Dr. Durrani.
Thank you.